So, I get a lot of questions about dental implants. Most of them relate to, aren't they expensive? And does my insurance cover dental implants? Well, each insurance plan is different. An insurance plan is a contract between your employer and the insurance company. And in efforts to make the plan affordable, some insurance plans will cover the dental implants and some won't. But it's important to recognize that even if a plan does not cover dental implants, it may provide an alternative benefit which could be used to help cover the cost of having dental implants done. The reality is, alternative treatments for dental implants can sometimes be more expensive than having the implant itself placed. The best way to determine whether or not a dental implant is covered by your plan is to reach out to them. So if you have an online portal, you can go about it that way. But a lot of times we do this for our patients to make it easier for them because we're much more familiar with the dental gibberish or terms that an insurance company may use than you might be. So if you're considering dental implants, give us a call. We'll look at your insurance benefits and give you a realistic breakdown of what they will cover towards the investment in your dental care. A lot of time, I get questions like, are dental implants painful? And truth in fact, they're not. Quite often, people will ask me, I have a missing tooth, but I'm concerned if I replace that tooth with a dental implant and a tooth on top of that, will it look natural? Or will it look like it's something artificial? Well, when we look at the options for tooth replacement, we have a couple of choices. We can do a fixed bridge, which is a fancy way of saying that we cap teeth on either side of the space and put an artificial tooth in between. That has a couple of advantages. It's quick and can be done in 2 visits and gives you an answer for the missing tooth. But it has a couple of cons because we have not only the tooth that's missing, but a tooth on either side of the space that are all connected together. The fate of all 3 teeth, so to speak, is tied together. So if you have a problem with one of the supporting teeth for that fixed bridge, then you have a problem with the entire fixed bridge. So another option that you might have would be to replace something with a removable denture. A removable denture is something that comes in and out of your mouth. As the name implies, it's removable and requires a fair amount of additional material, which certainly does not look natural, in order to support the missing tooth. The third option is, of course, dental implants. And what a dental implant does is it provides an artificial root inside the bone that a tooth can be built on top of. With newer techniques, those teeth look incredibly lifelike, and you would be hard-pressed to tell a tooth that had been replaced with a dental implant versus a natural tooth. So in short, if you're looking for the service that will provide you with a replacement tooth that most mimics what nature gave you in the first place, it's a crown on top of a dental implant. A lot of people ask me the question, what do dental implants actually look like? So to help out with that one, I figured I'd let you take a look. Basically, as we know, a dental implant is a titanium screw that is placed into the jawbone that we can attach a number of different things to, whether it's a single tooth, multiple teeth, a denture, or even a full set of teeth. In this particular case, we see someone who had multiple implants placed, and these implants are what we call root form implants because they're shaped a little bit like teeth. And what you'll see is the single tooth implant and a natural tooth next to it. So this will give you an idea of what that looks like. Now, the cool thing about this that I always liked in the pictures is that when you see this, it almost looks like there are little smiley faces in the implants. And indeed, the patient was smiling because this gave her a chance to see what it was like to have teeth again in an area where she had been missing teeth for a great many years. So now you know what dental implants look like. Give us a call and we can talk more about how dental implants may be able to help you. Often people will ask me when we talk about implants, how do they get installed and is it painful to have dental implants placed? Well, the answer to the second question is usually not. We get you very numb for the procedure. And the dental implant can either be placed at the time a tooth is removed. That's called an immediate implant because it's immediately being put in the same day that a tooth is being taken out. Now, keep in mind that when we do that, we're not putting a tooth on top of it. The implant will serve as a new root to support a tooth, but we need to allow time for the bone to heal and lock the implant into place. But if you're not having a tooth removed, say you already have a space and you're looking to replace a single tooth, well, the answer here is easy as well. What we do is get you very numb and comfortable, and then we move the gums gently out of the way. We place a hole into the bone to allow the implant to be inserted into that area, and then the gum is closed up over the site where the implant was placed. We give the tooth, the implant, a few months to heal and let the bone lock the implant into place, and then we proceed from there to make sure that that will last you a great many years.